Your questions about the vaccine, because we are getting lots of them every day. People writing in to say, hey, when will they be able to get it? Why are they having some hiccups with the whole process? What's going on with these shortages?
And joining us now to bring more clarity and ease your concerns is Dr. Syed Hussain from Trinity Health of New England. Doctor, thanks once again for being with us. First question here. The governor said just the other day that people over 65 will be able to get the vaccine in Connecticut very soon. He thinks within the next 10 days. What's your take on that?
Morning, Erica and Tim, and thank you for having me back. So I agree. We expect 65 years and above age group to be open for vaccination within the next couple of weeks. Right now, Connecticut is vaccinating 75 and above healthcare workers and long-term care facility residents. We really appreciate everybody's patience, and actually it's very heartening to see the enthusiasm that folks want to get vaccinated. One thing that Connecticut is doing really, really well, and something we should be really proud of, is that we lead the nation. We're among the top 5 states in terms of number of people vaccinated and also using up our inventory. So folks above the age of 65, it's a couple more weeks. And then once you're eligible to be vaccinated, please go to trinityhealthofne.org to sign up to get your vaccine.
Doctor, for the people who have had their second appointments canceled and therefore have to wait longer than the recommended amount of time, are they going to have to restart the series of shots again if they wait a certain amount of time, or does it not matter?
So the CDC does not recommend restarting the series. It does recommend sticking as closely as possible to the 3-week interval for Pfizer and 4-week for Moderna. The CDC also, in exceptional circumstances, allows us to the time period between the first dose and second dose to be up to 6 weeks. But as much as possible, folks need to schedule their appointment 3 weeks for Pfizer, 4 weeks for Moderna. And the best way to do this is when you're leaving your first dose appointment, please schedule on site before you leave your second dose appointment.
All right, now, if someone is fully vaccinated, can you unknowingly spread the virus to another person who hasn't been vaccinated yet?
So we don't really have data yet to give a definitive answer to that. What we do know, based on the studies from both Moderna and Pfizer, is that these studies were able to prevent severe clinical disease. The vaccines were able to prevent severe clinical disease. What we don't know, though, is how effective are they in preventing asymptomatic infection so that there's no transmission. That's why we keep saying, even if you're vaccinated, it is important to mask and stick to social distancing and practicing hand hygiene and avoiding crowds.
Talk to us about your thoughts about the Johnson & Johnson vaccine. Its numbers weren't quite as promising as Moderna's and Pfizer's, but it still seems like it's a net balance, definitely a good development for the U.S.
We are very encouraged with the Johnson & Johnson vaccine, and I'll tell you why. Viewers need to keep 2 data points in mind. One, 85% effectiveness in preventing severe disease, and 100% effectiveness in preventing hospitalization and death. So the most severe aspects of COVID-19 disease are preventable with this vaccine, and that's what we want to see. It's important that folks keep in mind that we are in a big war now with this virus in terms of time. Time is of the essence. So we need to get as many people vaccinated as possible so that mutations can stop and these variants can stop popping up, which may evade the vaccines.
All right, Dr. Hussain, thank you so much for your time once again and answering those really important questions for us and our viewers.